Welcome back. Our sponsors at the Western New York Integrated Care Collaborative strive to provide social care services and health education programs for individuals all around the community. And I'm joined now by Nikki and Sasha with more details on their resources. Welcome, ladies. Thanks for joining me.
Thank you. Thank you for having us.
Of course. I briefly mentioned a little bit about it, but can you tell us more about the social care services that you provide?
Yeah, absolutely. You know, it's study after study have shown that 80% of someone's health happens at their home, in their community where they live. And New York State has rolled out this new program for individuals who have Medicaid insurance to really help them in their home, in their community, with things like healthy food access and connection to job training, help with their housing, help with their home environment that might be causing them to get ill. So the Social Care Network provides those types of services through our partners, such as Gerard Place. We have 120 partners delivering services across 4-county region of Chautauqua, Cattaraugus, Erie, and Niagara. Yeah.
Okay, and Nikki, tell us how you educate the community on health and nutrition.
Yeah, so all of the folks who are eligible for these services can get connected with a dietitian who can help train them on budgets for food, cooking supplies, eating healthy. They also can receive, food boxes for the week with recipes and show them how to get healthier. And we have a whole slew of dietitians across the region doing this work.
Love it. And Sasha, a big part of what you do at Gerard Place includes housing programs and job training. So tell us more about your mission.
Sure. So we have a couple different housing programs. We have an on-site permanent supportive housing program, and then we have some community-based programs. And partnering with WNY has really allowed us to expand how we can help the community-based population. So if anybody is any Medicaid recipients that are at risk of becoming homeless or having housing disparities, we are able to screen them, and if eligible, we're able to help with things like back rent, security deposits, moving costs. There's so many things that we can help them with that we really just didn't have the opportunity to before. The programs that we did have were very specific, and it was really difficult to meet the eligibility criteria. So this just kind of opens it up to a bigger population.
Okay, so this partnership, is this newer, or has it been around for a while? Between Gerard Place
and so we got partnered probably earlier in 2025, brought in more network members. Our network had started about 8 years ago. We really started with older adults, and when this new program through Medicaid started, we applied to New York State, and now we've been able to expand the network to include more and more network members like Gerard Place.
And so what does this partnership mean for Gerard Place is it expanding your reach or is it expanding your resources?
It's a little bit of both. It's definitely given us the opportunity to expand what we already were doing, but to do it on a bigger scale. So we've always worked with moms and babies and done a lot of housing support. So through WNY and through Medicaid, it's just really upped what we can do in the amount of resources we have. We're able to provide pantry, 9 meals a week to pregnant moms, so that's really been a great way to expand our mom and baby program. Again, like the housing support is really great through WNY.
Yes, and recently you launched a new social care network, so tell us more about that and who that's serving.
That is what we're talking about here, the Medicaid members. So we recommend any of them to come in, do a survey that asks them questions about what their needs are. They will get connected to a navigator. The navigator helps them navigate the systems that are out there to help them get connected to permanent supports. A lot of them have different rules, like Sasha was mentioning, eligibility criteria. So having that one-on-one navigator really helps them get connected. They can call us, they can email us, they can reach out to us on our website, or any of our network members that they can go to their sites and get connected to get that first screening done.
It seems like, especially here in New York State and in our local 4 counties, there are so many resources available, but not a lot of people know about them or how to access them. And so you guys are kind of like the first step, streamlining people and helping hold their hand through the process of really getting the aid that's available to them.
That's right, yeah.
Alrighty. Well, is there anything else you want our viewers to know or first steps to take?
Yeah, I would just say reach out. This is a trusted thing. It's available through your health insurance, so you can trust it. You can take advantage of it. It's here, and it's really helping change the way that we're focusing on healthcare. We're really trying to avoid having to go to the hospital, right?
Right.
By getting people healthier in their homes.
Makes sense. Okay, well, thank you so much for coming in, ladies, and sharing more about this comprehensive service. Viewers, if you'd like to learn more about Western New York Integrated Care Social Care Network, visit our sponsors at WNYSCN.org or call the number right there on your screen. Thanks again for coming in.
Thank
Thank
you.
you.